does a man know he has a weak pelvic floor? You got to understand that weak pelvic floor is just the presentation of the muscles inside your pelvis. And you can't have weak pelvic floor without weak everything else inside your pelvis, because your floor is not separate from the walls of your pelvis. Typically, weakness happens as a result of what's not happening on the outside. So a lot of time, you got to understand the muscles inside your pelvis work with the muscles outside of your pelvis to stabilize your pelvis. If that stability is not being provided properly on the outside, then the inside has to respond accordingly. So how to tell if it's weak is typically from presentations like not being able to urinate properly, like maybe basically not holding the urine properly, or it can happen with defecation as well. Those are the symptoms that people can have, and addressing those without addressing why the muscles inside of your pelvis are tight is one of those things that will continue being a perpetual problem. So it's an ongoing problem, and over course of, depending on how old you are, your age could be blamed for it. And then there are so many tools and devices and medications that can be used. But the reality is you need to work on strengthening these. The way we naturally strengthen the muscles inside of our pelvis is through biological breathing in the process of breathing out. So when you go to, let's say, a pelvic floor therapist, physical therapist, and they go inside through the anus and try to have you do the contraction and try to really make you do the Kegels, as it's referred to, what they're trying to do is assess how much you're able to contract those muscles. In nature, it is the contraction of those muscles that initiates the process of breathing out. So if you work on your breathing in, the breathing out correctly biologically, then your body automatically does the breathing out process like it's designed to do. Breathing out is not it's just a natural response that we do. Breathing in, we can modify it. So my suggestion to patients that come in with presentations that appear to be weak pelvic floor, when in reality I see instability of their pelvis, therefore the muscles inside their pelvis are weak, is to start with biological breathing. Then I proceed to see how they're moving, because clearly the stability of the pelvis itself and what it's connected to, which is your spine, the structures above, and your lower extremities on the two sides. Then if there is a tweaking or if there's a modification in the how these movements happen, those are the reasons why the muscles on the inside are not responding well. And the answer ends up being weakness of those muscles. Of course, we want to rule out pathological reasons, pathology behind those the weakness, which typically by the time you end up in a rehab clinicians for your pelvic floor dysfunction, all of those are already done. Chances are you're already referred to see one, but what does not happen typically is looking at the patterns of movement and stability of your pelvis as a big potential culprit. And in my opinion, it is the big one. Hope this helped.